I knew the exact day when I had conceived my daughter. I knew when I had ovulated, by the pain of course, and it was from the left ovary if you were curious. And I had documented when my husband and I were last involved. So I knew within a 2 to 4 day window when his sperm would have met my egg to make our daughter Ellie. After getting the positive home pregnancy test that I was eagerly waiting for, I determined the number of weeks pregnant I was from all of the data I had been collecting and went to the OB to fill out the pregnancy paperwork. They called me the very next day and congratulated me on being 6 weeks pregnant. I cocked my head in utter confusion while I was on the phone and told the nurse, "But I'm not 6 weeks pregnant, I'm only 4 weeks pregnant." The nurse chuckled and said, "No, based off of your last period, you're 6 weeks pregnant, and your due date is March 28th, 2020. I was still so confused, but decided to let it go and begrudgingly accepted the fact that I was somehow 6 weeks pregnant, even though I knew it was literally, physically, biologically impossible for my egg to have been fertilized 6 weeks ago. So let's talk about the science behind how many weeks pregnant you are and how your projected due date is calculated. Welcome to the Deconta channel, where we discuss all things educational and we never duck away from the difficult topics. Subscribe to support free, quality education and to stay in the know. Do your part by watching one full episode and expressing your like or dislike and comment below. So why didn't the nurse's number of weeks pregnant match what I had originally determined? Well, turns out that most women who get pregnant don't actually have a pinpointed date of when the conception, the sperm meeting the egg, actually occurred. Because of this, when a doctor determines how many weeks pregnant you are, they have to base it off of a consistent date, a date that they know for sure happened. And that date happens to be the first day of your last menstrual cycle. This means that week 1 of the average cycling woman's pregnancy is technically beginning on the first day of her period. So she's obviously not pregnant yet. She's on her period. But according to the medical field, this would be week 1 of pregnancy. By the end of week 2 of pregnancy, this average cycling woman would release an egg to be fertilized. Again, she's still not pregnant, but this would still be considered week 2 of her pregnancy. Then, within week 3 of pregnancy, if this hypothetical example woman were to have sex, then her partner's sperm could meet with her egg and become fertilized, creating a zygote. If this zygote were to continue growing and become a blastocyst, and that blastocyst were to implant in her uterus wall during week 4, then she would be officially pregnant by week 4 of pregnancy. However, if the blastocyst does not implant during week 4, then this whole cycle would start all over again. In other words, there is a 2 to 3 week window from when your egg became a blastocyst implanted into your uterus wall, releasing HCG hormone in order for a home pregnancy test to be able to detect that you are actually physically, biologically pregnant. This 2 to 3 week discrepancy can also be the reason why your baby might be born at 37 weeks or might be born at 41 weeks. There's a certain amount of wiggle room at full term, early term, or what term you can give birth safely at. Now, with that much wiggle room time period, you think it'd be practically impossible to calculate your due date. But there is a rhyme and reason to the way doctors do this. In order to calculate your due date, we're going to start with the same logic as before, the first day of your last menstrual cycle. Since the average pregnancy lasts 40 weeks, or 280 days, the easiest way to calculate this is to go back 3 calendar months from the first day of your last menstrual cycle. For example, in order to calculate my daughter's anticipated due date, I would need to know the first day of my last period before she was conceived, which happens to be a date of June 21st, 2019. From there, I need to go back 3 calendar months. That would land me at March 21st, 2019. Now all I need to do is add 1 calendar year plus 7 days to that, and that happens to land me at March 28th, 2020. This method is just a shortcut, as opposed to counting out 280 days from the first day of your last menstrual cycle. Although if you have that kind of time to burn, that method would work just the same too. So what's the reality here? Who was right? The nurse or me? That ultimately depends on your frame of reference. If you thought of weeks pregnant as I originally did, where week 1 of pregnancy should have logically meant when the blastocyst implanted in my uterus wall, then you'd need to think about your weeks pregnant in a developmental sense a little differently as well. For example, it's a well-known fact that the human heart starts beating at 6 weeks old. But if you're basing how many weeks pregnant you are off of when the blastocyst actually implanted, which would be the point when you actually conceive, then your growing little human would be a mere 4 weeks old roughly when his or her heart starts beating. That's pretty incredible, isn't it? But since your OB will likely include those first 3 weeks of your body preparing for pregnancy as a part of your number of weeks pregnant, just keep in mind then that within those first 3 weeks, there's not even an embryo present yet. And as for your due date, remember, it's just an approximation, not a guarantee. I mean, our daughter surprised us by coming an entire 5 weeks early. Meanwhile, my sister-in-law had to deliver a week after the 40 weeks gestation and had to be induced. Ultimately, the bottom line here is that the nurse was correct in how many gestational weeks I was pregnant, or the gestational age of my daughter. Meanwhile, I was correct in how many embryonic weeks I was pregnant, or my daughter's actual fetal age. You can see how it'd be rather confusing to discuss how many weeks pregnant you are out of context. After all, a 2 to 3 week discrepancy is a huge difference when we're talking about developmental milestones. In my opinion, at least. So when are you due? And what are your parent senses telling you about this due date? Will it be correct? Will you be overdue? Will you be early? What do you think? Tell me about it in the comments below. These videos take me and my team quite a bit of time to make, but it only costs you a second to either like or dislike this video. To join me next week on the super simplified science of pregnancy, a 40-week series, all you have to do is subscribe. Thank you for watching and see you next week.